Hello, and welcome to Opt to Thrive, episode 48. What your wearable can and cannot tell you about your health.
Welcome to Opt to Thrive, your go-to podcast for women's wellness in midlife, designed to educate, support, and inspire you to live your very best life. And now your host, Dr. Karina Sims.
Hello. So today we're talking about wearable health trackers. Finally! I have been wanting to tackle this one for quite some time now. I was right into it some weeks ago, and then I got a little sidetracked with all the abnormal bone density test results that I've been getting. So I did that episode on bone health, and if you haven't had a listen, you're a midlife woman, I highly recommend that you do have a listen. I cannot count the number of women I am seeing who have been denied a bone density test because they aren't yet 70 or they don't meet a very short list of criteria for an early test. I have one patient, in fact, who has in the last year been hearing me talk, as I do, about resistance exercise and how important it is for our bones. So she's gotten on board, never having done much resistance training before. And about the same time, she was finally given a bone density test after having been refused one over the last few years when she requested because she was told she was too young, in her late 50s. And she didn't meet the criteria. I did pick up a few risk factors that I thought were significant, and we got her a bone density test, and unfortunately, her results have returned with the diagnosis of full-on osteoporosis. So please, if you missed that episode, please go back and have a listen. It is so important. But yeah, I did get sidetracked. Probably wasn't overly hard to do because this topic today has been really challenging to research. Technology is growing so fast, and in fact, it can be faster, and in fact, it is faster than the scientific research can be done. There are no clear guidelines available from any of the major organizations that I would normally be looking at first. My college, the Royal Australian College of General Practitioners, has announced there will be some guidance available this year for wearable health trackers. But that's great, but here I was, left to sort and sift through it all myself. One of the things that I was most concerned about was that studies done even a few years ago could be out of date by now. A lot of the information I found was coming from the data the manufacturers who actually make the wearables provided, or from papers that the manufacturers had sponsored, which of course made me a little uncomfortable just relying on that. And then there were several papers that highlighted the differences in testing in different studies and how the manufacturers aren't always forthcoming with their data and how, again, the technology is so rapidly changing. So I really had my work cut out for me looking for information I felt I could trust and share with you today. I have done my very best, and I think I've done a pretty good job. So, why have I put so much time and effort into this topic? Well, if you're not wearing a wearable health tracker, a Fit Watch, or a Ring, I would say you could soon be in the minority. They're extremely popular and growing, and statistics tell us that somewhere around 36% of Aussies are apparently wearing one right now. And as I said, with technology rapidly improving, there are more and more things being added to the list of data that they may be able to provide us with information about, and I have no doubt they will be getting more and more accurate with time. And that's one of the things I really wanted to look at today. How accurate are they, really? What information can we rely on? What exactly can they tell us? How can we use them to improve our health? Now, I myself have always hated wearing a watch, and I used to only wear one when I would go out. I really hate the feeling of something tight around my wrist. But I myself started wearing one a few years ago for a very specific reason. This is by no means saying that I think everyone should go out and get one. I'm going to talk about my experience, and I'm going to talk about my experience with patients wearing them and where I've seen them be helpful and where I have seen them cause some issues. So I started wearing mine during the time when I was determined to get my body sorted out. I was being pummeled by the midlife transition. I was determined to improve everything that I could in an attempt to regain what felt like a loss of control of my own body, my body composition, my energy. I just wanted, like many of the women I see in my clinical practice and the women I work with in the Reset program, I just wanted to feel better. So I got my watch in particular in the beginning, really just to track and try to improve my sleep. My sleep was one of the biggest issues at that point. And then also, of course, there were all of the carry-on effects that come from having really crappy sleep. But then I realized there were so many other things that I could track. And I am a data girl. I do like numbers and statistics. You might have noticed. I love playing with data and manipulating data. When I was doing triathlons in my early 40s, I got a Garmin watch back then, and I tracked my speed and my time and my heart rate and all the things. And I just loved it. So yeah, I'm one of those kind of people. And so my watch really opened up this whole new world for me. For those of you who are wondering, I just have an Apple Watch. I like the idea of it being the same as my phone, and honestly, in the beginning, I wasn't overly fussed. As I said, I just wanted something to help me track my sleep. And of course, by no means am I recommending an Apple Watch. It's just what I ended up having. One of my girlfriends has a type of wearable called a Whoop, which is another wrist-worn device, and she would sometimes comment on what she was noticing in her health metrics on her Whoop, in particular when she drank alcohol. Her Whoop would give her what is called a daily recovery score, so a number to tell her how recovered her body was as she started the day. She was keeping an eye on her recovery score, and the score would show up in the green, obviously good, the red, obviously not so good, or yellow, somewhere in between. Now, before even monitoring this recovery metric, she was already starting to see the changes and how alcohol was impacting her in a way it never really had before. In this midlife period, she was starting to notice even a small amount of alcohol was impacting how she felt mentally and physically. And then by watching these health metrics, she was also starting to see the actual measurable physical effects of how alcohol was affecting her body. So I was starting to see there were so many things other than sleep that could be tracked and may be of use. Now, as I said, I love numbers, I love data, so I was pretty keen to dive in. But I had heard conflicting reports, and I wasn't totally sure about the accuracy of the information or health metrics that were being collected. I had done some superficial research, but was really keen at some point to do more of a deep dive, and now I've finally gotten around to it. So today I'm going to break it all down for you. I'll start with sleep and what these trackers can and cannot tell us about our sleep. I'm going to talk about recovery, that recovery value my girlfriend was monitoring, and I'm going to talk about cardiac monitoring as well. It's going to be really fun, so let's dive in. Now, first, let's explore a little bit about how they work. There are 7 main sensor types used in smartwatches or wearable devices: an accelerometer, heart rate monitor, SpO2 or oxygen saturation sensor, skin temperature sensors, ECG sensor, a gyroscope, and GPS. Okay, so I'm going to nerd out just a little here because I think this is fascinating. But if you want to skip ahead, please do. I'm not going to hold it against you. I just want to quickly go through how these sensors work. So an accelerometer is a sensor inside a smartwatch or a wearable device that detects movement. It measures how your body's moving and changing speed, and that helps the device know when you're walking, running, or sitting still. Because of this, accelerometers are used in almost all of these devices. They allow the device to track activity by counting steps and estimating distance traveled and calories burned. Now, gyroscopes are another sensor in the smartwatch similar to accelerometers. They both help the watch understand movement, but they measure different things. An accelerometer, as we said, detects movement and changes in speed with walking, running, or stopping. A gyroscope detects rotation and direction. It can tell when your wrist twists, turns, or changes angle. And when used together, these sensors give the device a much better picture of how your body's moving and how the device is positioned. And it's what makes your watch screen activate when you lift your wrist to look at it. The heart rate sensor in a wearable measures how fast your heart's beating by tracking blood flow at your wrist. Most modern devices do this using a technology called photoplethysmography, or PPG. The sensor shines a small green light onto your skin. You probably have seen this when you've taken off. I know I have. Some of that light is absorbed by your blood and some is reflected back to the watch. So each time your heart beats, more blood flows through the blood vessels in your wrist, which changes how much light is absorbed and how much is reflected. So the watch then detects these tiny little changes in reflected light and uses them to calculate your heart rate. The SpO2 sensor in a wearable measures how much oxygen is being carried in your blood. This is called your blood oxygen saturation, and we look at it as a percentage. The sensor works by shining two different types of light, red and infrared, into the skin at your wrist. Oxygen-rich blood and oxygen-poor blood absorb these lights differently. By comparing how much of each light is reflected back, the device can estimate how much oxygen your blood is carrying. A reading of around 95% or higher is generally considered normal for most healthy people, though most of us are going to have a saturation of 97 to 100%. Skin temperature sensors in smartwatches measure the heat coming from the surface of your skin. An ECG, or for our North American friends, an EKG sensor, measures the electrical signals that control each one of your heartbeats. Every time your heart beats, it produces this small electrical impulse, and the ECG records this activity as a wave pattern. Some of the devices have built-in ECG sensors that can capture these signals through the skin, usually when you place a finger on the device. The device then analyzes the pattern and the timing of your heartbeat to check for irregular rhythms, such as atrial fibrillation, which we're going to talk about more later. Now, when the data is combined with information from other sensors like heart rate or blood oxygen levels, the device can monitor heart rhythms over time and tell you if something unusual is detected. The GPS in a wearable uses signals from satellites to work out your exact location and track where you move over time. This helps the device more accurately measure distance, pace, and routes during activities like walking, running, or cycling. It can also map your workouts and give a clearer picture of how active you are throughout the day. Because GPS needs a strong signal and it works continuously while tracking, it does use more battery power. Okay, thank you for indulging me. I hope some of you at least found that as interesting as I did. Now, the main health metric I want to look at today is the one that got me onto my smartwatch, so sleep. The gold standard in measuring sleep is called polysomnography. And because this is the gold standard, if we want to know how accurate our device is at monitoring sleep, then we need to know how it stacks up against polysomnography. So polysomnography is a detailed test that measures what your body's doing while you sleep. So it's a sleep study, and it records things like your brain waves, your eye movements, muscle activity, heart rate, breathing effort and airflow, oxygen levels, and your body position. And it's because it tracks so many things at once that it is the gold standard for diagnosing sleep problems like sleep apnea, narcolepsy, parasomnias like sleepwalking, and movement disorders during sleep. A sleep study can show which sleep stages you go through, rapid eye movement or REM sleep, and non-rapid eye movement, non-REM sleep. Remember, non-REM can be light sleep or deep sleep. Those are separate stages. How long you spend in each stage, whether you stop breathing or you're breathing shallowly, whether you wake up briefly without realizing it, or whether your legs move excessively during sleep. Most of these tests are done overnight in a sleep lab, but there are also some sleep studies that can be done at home with portable equipment, but that's a talk for another time. So when we compare our wearable to the gold standard, how does it stack up? Now, in terms of mechanism, again, so fascinating how these devices work, and I think helpful in better understanding our sleep altogether. What wearables do is measure patterns. They use a combination of the sensors we talked about earlier to infer sleep or draw conclusions based on what they're picking up on the sensors. The big ones are movement. First, it looks at how much you move. When you're asleep, you're generally still, especially in deeper sleep. If you're tossing and turning or getting up, it assumes you're either in a lighter sleep or you're awake. It looks at your heart rate, which changes depending on sleep stage. During deep sleep, your heart rate tends to go slower, doesn't fluctuate as much as it does during REM sleep. In deep sleep, our parasympathetic or rest and digest part of our nervous system is more dominant. In REM, our sympathetic or fight or flight nervous system is a bit more active, so heart rate becomes a bit faster with a little bit more up and down, similar to when you're awake but lying still. This variability in the heart rate is called heart rate variability. Makes sense. It's just the tiny variation in time between heartbeats. So even if your heart rate is 60 beats a minute, your heart is not actually beating exactly once every second. It might be after 0.92 seconds, then 1.05 seconds, then maybe 0.98 seconds. That variation is normal and healthy. So it's not how fast your heart beats, but it's how flexible your heart is in responding to signals from your nervous system. We're going to talk a bit more about this later because it's one of the common metrics that people measure. So I'll just leave that there for now. Okay, so our wearable also looks at our rate of breathing. It can estimate breathing rate by detecting small movements in the wrist that are associated with the rise and fall of the chest during breathing, along with changes in blood volume in our pulse. Slower, steadier breathing usually suggests deeper sleep. And finally, some of the newer wearables can estimate oxygen levels overnight. So when your watch tells you you had 1 hour of deep sleep and 2 hours of REM, it's not measuring brain waves like a sleep study does. It's just putting all of those signals together: movement, heart rate, HRV, breathing, and using algorithms to make an educated estimate. Okay, so how do our devices stack up against the gold standard? What does the evidence tell us? Earlier last year, there was a meta-analysis published in the Journal of Clinical Sleep Medicine titled Performance of Consumer Wrist-Worn Sleep Tracking Devices Compared to Polysomnography, a meta-analysis authored by Young, Jiyoung, Lee et al. So a meta-analysis mathematically combines the results of multiple studies to give us one estimate. You can think of it like we've taken the data from all the studies and we've calculated one overall result. The study systematically looked at the accuracy of several popular wrist-worn sleep trackers and how they measured up against the gold standard polysomnography. They included data from 24 studies totaling 798 participants using devices such as Fitbit, Jawbone, Whoop, Garmin, Apple Watch, and Xiaomi Mi Band 5. I'm not sure I'm saying that right. What they concluded was that wrist-worn sleep tracking devices are not as reliable as polysomnography in measuring key sleep parameters like total sleep time, so how much you actually slept, not how long you were in bed, but the total amount of time your body was truly asleep during the night. They're not as reliable with sleep efficiency, so the percentage of time in bed that you're actually asleep. So if you're in bed for 8 hours but only slept for 6, your sleep efficiency is about 75%. A normal sleep efficiency is between 80 and 90%. Our trackers are also not as reliable for sleep latency. That's how long it takes you to fall asleep after you start trying to. Okay, so this paper tells us they're not as good as the gold standard. But can they still be useful? The recommendation from this paper was that physicians and consumers should be aware of the limitations of these wearables and interpret the results carefully, but that wearables can still be useful for tracking general sleep patterns. We're going to talk more about this in a second. But first, I did find another paper published in 2024. It's what is called an umbrella review, and it was published in the Journal of Sports Medicine. So an umbrella review looks across many reviews to show the big picture strength of evidence on a topic. And in this case, they looked at 24 systematic reviews with over 400,000 participants. But this was looking at lots of other metrics, some of which I'm going to talk a bit more later. But in terms of sleep, they looked at 4 systematic reviews that included nearly 3,000 participants. What they found was that wearables tend to overestimate total sleep time and sleep efficiency by more than 10%, and they underestimate sleep onset latency with errors ranging from 12% to 180%. Now, this is probably a great time to point out that accuracy between the different devices has to vary as well, right? And obviously, sleep latency appears to be a big one. And remember, we talked about how these are all estimates based on patterns our devices are picking up. And as we get further away from what we're actually measuring with anything really, and we're getting more into estimating, there's obviously more room for error. In my research, one of the closest things that I could find to a guideline was a paper from the World Sleep Society with recommendations for the use of wearable consumer health trackers that monitor sleep. And in that paper, they point out that for devices that rely on motion for sleep detection, there are some important challenges for a device to work out if you're asleep or you're awake. One of the challenges is for people who lie very still while they're awake. Another is in the differences in how much we move while sleeping, because this can be affected by lots of things. Age, being physically exhausted, having joint stiffness or pain, conditions like depression, some medications, or even just laying there quietly awake before you decide to get up. Or even trying not to totally wake up because you want to try and get a bit more sleep. Because there is this well-known phenomena of people thinking that they haven't slept when they actually have slept. I know I've looked back at my data the next morning to see if I actually fell back asleep. Now that I know this, I realize it's probably not that accurate. Now, having said that, they do go on to say in this paper that thermal sensing, so detecting body temperature changes, can help with sleep detection because our distal skin temperature, the temperature out towards our hands and feet, rises before we fall asleep, and our core body temperature, the temperature inside our body around our organs, decreases. So devices that are able to also sense temperature may be a little better at determining sleep versus wake. Now, I assume that all devices have a temperature sensor, and from what I can gather, I think most of the common devices now do, but apparently this wasn't always the case. There appears to be a time not so long ago when only mid to higher end devices offered this feature. As I said, technology is rapidly growing. Now, apparently, thermal regulation is also what helps our devices decide what sleep stage we're in. Our body's thermoregulation, so regulation of our temperature, is apparently less efficient during REM sleep than it is in non-REM sleep. So picking up these little changes may also help our device decide what sleep stage we're in. And this brings me to the elephant in the room. Because so far, what none of these papers have mentioned was how accurate the wearables are at distinguishing sleep stages, in particular, deep sleep. For me, and I know many others, that is what we're probably most interested in. At least that is what I get the most questions and concerns about from my patients. Now, I mentioned earlier I couldn't find any guidelines, but I did find those recommendations from the World Sleep Society. Disappointingly, though, for sleep stages, the recommendation was pretty brief. Essentially, it just says that experts do not fully agree that wearables identify sleep stages accurately enough for precise conclusions, but that if you're generally healthy and you look at trends over weeks rather than individual nights, the data could be useful. In fact, that pretty much sums up a lot of what I read about using a sleep tracker in general. None of the information is going to be diagnostic, but we can look at the trends in the context of symptoms to decide if further testing needs to be done. And there's still another metric we haven't really discussed yet, and that's the sleep score you get on your app. So essentially, your device sends its data to whatever app it's using. Many of the devices will have their own app. When I first got my device, which as I said is an Apple Watch, I wanted more information than the app was giving me, so I downloaded a separate app to use. But here's what you need to know. Each app will have its own algorithms, so scoring systems. Remember, there are no standards here. Each manufacturer is making their own algorithms, so your sleep score in your usual app may show one thing, and then if you had your information going also to another app, your scores may be different. So who really knows what the sleep score really means? It certainly cannot be compared to the sleep score you would get from a proper sleep study because you could be comparing apples and oranges. So there really isn't even any such thing as a score to aim for. The manufacturer will tell you what they think is a good score. So I think the usefulness of a sleep score is in relativity. With lots of data, you'd have a baseline score, so where you normally sit, and then if you decide you wanted to improve your sleep, maybe practice better sleep hygiene, or you wanted to see if cutting alcohol out, that kind of thing, and then seeing if your sleep score improves, it could be helpful. or helpful if you notice that every time you have champagne, your sleep score drastically drops, then that may also be useful information and great for awareness. Now, it probably is worth saying correlation doesn't necessarily mean causation, as in there could be some other variable involved, like maybe you go to bed earlier when you don't have alcohol and that's what's improving your sleep score, something like that. Anyway, something just to be aware of. I think anything that improves awareness, though, is a positive thing. So when might we be concerned enough about our sleep data to have a chat with the GP about it? Well, as I said, the rest of the story is really important here. Do you have any concerning symptoms, or do you feel fine, but you're just really bothered by that low sleep score? I think if you aren't waking feeling refreshed as a rule, it's not just here and there, but as a rule, it is worth having it looked at. And I want to give you a few more parameters that could prompt you to have a chat with your doctor. If you're waking up frequently during the night on 3 or more nights a week, remember, waking once per night or having brief, easily forgotten awakenings through the night is considered normal. If you're taking more than 30 minutes to fall asleep, if others are telling you that you're snoring or it looks like you're stopping breathing in your sleep, if you're waking yourself up with a gasp or choking or coughing while you're asleep, if you're sweating excessively or getting up multiple times through the night to visit the loo, those are all things to talk to your doctor about. If you're getting uncomfortable leg sensations before you fall asleep, like an overwhelming urge to move them or stretch them, and you get partial or complete relief when you do that, then you'll also want to mention this to your doctor as well. I think if a patient reports minimal deep sleep on their wearable and they have symptoms such as excessive daytime sleepiness, cognitive impairment, or mood disturbance, then it is worth considering a sleep study. For most healthy adults, deep sleep makes up between 10 and 20% of our total sleep time. So that could be somewhere between 40 minutes and 110 minutes for an average 7 to 9 hour sleep. If it's a 6-hour sleep, then that could be as little as 36 minutes of deep sleep. And just in case you didn't know, generally 7 to 9 hours of sleep a night is what's recommended. But if you get 6 as a rule and you feel great, then 6 could be fine for you. But in terms of deep sleep, there really is no agreed upon number for how much is normal or ideal. So we can't really place too much importance on the exact amount or percentage of deep sleep that we're seeing on our tracker anyway. We should be looking at our numbers as a general guide and looking at trends rather than a precise or definitive measure. Honestly, it's probably most helpful to instead focus on how you feel in the morning and throughout the day. Because deep sleep's needed to have a fully restful sleep, feeling refreshed and alert is a sign that you're likely getting a good amount of deep sleep. If you are, as a rule though, getting very low amounts of deep sleep, so consistently less than 10%, not just, occasionally here and there, a small amount, it is worth having a look into this. This is my advice, not from any guideline or paper really, but just knowing that there are several things that can really affect that deep sleep, it's worth checking it out. So what's the verdict? Is using a wearable helpful for our sleep or not? Personally, tracking my sleep was very helpful because it made me so much more aware of how I was going with my sleep hygiene. So those everyday habits and routines that help us get good, restful sleep. Now, if you aren't entirely sure what those are, because there is a whole list of them, I'll leave the link to my previous sleep episode in the show notes. And seriously, having good sleep hygiene can really be a game changer. In fact, if you're nailing your sleep hygiene and you're still having issues with sleep, that is definitely a sign you need to see your doctor. So yes, I do think these devices are great for raising awareness of our sleep health and any sleep issues that we might have, which then helps us identify where we can improve things. And if there may be sleep disorders, they may even be helpful for showing red flags to trigger further investigation. But there are also some dangers for some people using these devices, and you know who you are. I found one study that looked at what happens when people with insomnia are told they slept well or that they slept poorly, even when that feedback isn't true. Researchers gave participants fake positive or negative sleep reports through a device that mimicked a sleep tracker, and then they tracked how they felt and functioned throughout the day. Those people who were told they slept badly felt more tired, less mentally alert, and actually functioned worse by the evening, even though their actual sleep was no different. Those who got the positive feedback had a significantly greater increase in positive mood and alert cognition, and they were significantly less sleepy and fatigued. Such a great example of how powerful suggestion really can be, especially when it comes to sleep. What people believe about their sleep really can strongly influence how they feel during the day. And this is why the gold standard of treatment for insomnia is CBTI, cognitive behavioral therapy for insomnia. It makes so much sense. Certainly learning this was also very helpful for me. It even carried over to those times in the night when I'd wake up at maybe 4 a.m. and my brain would be freaking out that I wasn't going to get enough sleep, that I was going to be so tired. I just knew I wasn't going to be able to function. I dreaded the day ahead. You can guess how I felt on those days. When I got my head around what my head was doing to my sleep, it was so much easier to go back to sleep. Another great example of how powerful our brains really are. There's also a condition that's worth knowing about, orthosomnia. This is when some people become overly focused on getting perfect sleep numbers from their health tracker. This fixation can cause a lot of anxiety about sleep and also cause unhelpful behaviors that can then worsen sleep quality and insomnia symptoms. People with orthosomnia can often trust the sleep data in their tracker more than they trust how they actually feel. This reminds me of a saying we have in medicine: treat the patient, not the numbers. For example, if an otherwise healthy patient's running about, happy as Larry, but our routine check shows a low blood pressure, we don't really worry about it too much. It's very likely normal for them. So if you think this is you and you're starting to get a little obsessed with your numbers, maybe waking up and looking at your data to decide how tired you're going to feel today or how well you slept, or it's making you anxious around bedtime, it's probably time to stop looking at it, or at the very least, maybe taking a break and try and remember how you feel is going to be more accurate and therefore more important than the numbers on your tracker. So going back to those recommendations from the World Sleep Society, they advise that individuals should be encouraged to review 1 week averages of sleep measures rather than single nights, and they should be educated on the effects of acute versus chronic sleep disturbance, meaning that an occasional bout of bad sleep may affect that day's performance, etc., but it is really when we're seeing bad sleep for longer periods of time, so more chronic, that it puts our health at risk. Acute sleep disturbance would generally be considered issues lasting for under a month, and chronic would be considered happening 3 or more days a week for at least 3 months. Okay, now to finish, I'm not going to go into as great detail with the rest of the parameters as I did with sleep, but now that you have a good solid knowledge base, we should be able to get through these pretty quickly. Let's next go to HRV and recovery. I touched on HRV previously, so remember, it's heart rate variability, and it's essentially meant to tell us how well our nervous system is coping with stress and recovering. There are some standardized formulations for calculating HRV. However, the data that is put into those formulations and the particular formula a manufacturer uses is up to them. So again, hard to standardize. There can be many variables, including when your device collects the information, how long it collects the information for, etc., etc. In fact, if you try to look up what a good HRV is, you're not going to find any evidence-based reliable tables of normal HRV values listed by age and sex that we can easily compare our numbers against, because they don't yet exist. Again, looking at trends in your own data, not comparing it to others, is the way to go. In general, we want a high HRV. But what is a high HRV? Well, it's going to be relative, meaning if we look at your average HRV over time, let's say it's sitting around 50 most of the time, then if we want to improve our health and we decide to stop drinking alcohol or start exercising more or prioritizing our sleep, then if our HRV goes to 55 or 60 the majority of the time, then what we're doing looks like it's probably having a positive impact on our HRV. Things that we know that lower HRV are things like aging. So my HRV compared to my daughter's HRV are going to be totally different. Being physically deconditioned or unfit, or alternatively being overtrained or not letting your body recover enough between exercise sessions. if we have an infection or we're ill, we're stressed, we're not sleeping well. Some medications can lower HRV, as well as alcohol, nicotine, caffeine, or even being dehydrated. So really, the best HRV is your personal normal, and changes over time, not comparison to others, are what matter most. We can look at recovery scores much the same way. There's no universally accepted standard rating system for assessing recovery by our wearable devices. The manufacturers all have their own secret little algorithms, and many of them don't publish them. In general, though, a recovery score is thought to take into account heart rate variability, resting heart rate, sleep metrics, and activity data, and then create a score out of all of that and or a color-coded indicator. Mine gives me both a color and a number, and I do like watching it and seeing how it may be affected if I've had a bad night's sleep or I had some alcohol, etc. But it really is just an out of interest thing, and maybe sometimes it could hold me a little accountable when I can see an objective measurement of how my body may be responding to how I'm treating it. All right, the next thing I want to look at was your wearable's ability to pick up abnormal heart rhythms. I had a patient come in very stressed recently and wanting a referral to a cardiologist because her Apple Watch told her she was having atrial fibrillation less than 2% of the time. Well, my Apple Watch tells me this too. So I learned a really valuable lesson here, and I'm sure I'm not alone. Hopefully I'm going to shed some light on something for some of y'all I think is pretty important. So atrial fibrillation is a reasonably common abnormal heart rhythm. We're more at risk of developing it as we age, and it can cause a stroke. So it's pretty important to know about it if you have it, because you can have it without having any symptoms at all. Okay, so when you set up AF history on your iPhone, it does ask you if you have a doctor's diagnosis of AF, so atrial fibrillation, and explicitly tells you not to turn it on without an actual diagnosis. Now, it may have, I don't recall, but it may have explained why, and I may not have actually read that. I honestly can't remember if it tried to tell me or not why I shouldn't turn it on without a diagnosis. But my thinking was, well, if I have AF, I want to know about it. So I want it to be checking. Then when I got my message that I was an AF less than 2% of the time, at first I thought, what does that mean? I only had a little bit of AF? Well, it turns out when you turn the AF history on, it is looking for AF. Not continuously, but occasionally it checks in to see if you have an irregular heartbeat. And if it does pick it up, it just takes note. And then once a week, it sends you a little report about how much AF you had. It turns out it's never going to say 0%. In fact, 2% is as low as it goes. I'm not exactly sure why, but that's the report. Maybe because it only checks in once in a while and it doesn't want to say 0% because it can't be sure. I don't know. But what also happens, and this is the important thing, what also happens when you turn on the AF history feature is that the device actually turns off the irregular rhythm notifications feature because you already know apparently that you have an irregular heartbeat, so they don't need to tell you about it. So yeah, you may want to pause right now and go and turn your AF history off if you're a little bit naughty like me and shouldn't have turned it on in the first place. Because irregular heartbeats are one of the things that our watches can tell us. They aren't always accurate, so it's not diagnostic, but I have sent a few people to the cardiologist now with unusual heart rate patterns, and the cardiologists do take it seriously and they look into it. I have yet to have someone come in with an actual new AF notification, but if that were the case, I'd be following it up with an ECG and maybe even a Holter monitor, which is a small heart monitor they can wear for weeks at a time if they need to, because atrial fibrillation can come and go. Now, if your device does have an ECG feature and it alerts you that you're having an irregular rhythm, one of the best things you can do is to try and get an ECG while it's happening so you can share that with your doctor, which just gives them a bit more information. Okay, wow. I think that we've probably had enough. This has turned into a bit of a long one, but I just maybe want to say one last kind of closing comment, and that's if you're getting some data with your device that you're concerned about, And especially if your intuition is telling you something's not right, just go and have the conversation with your doctor. Let them take a history and decide if any further investigations need to be done. One of the things that I would suggest that you do take to the doctor, if you're especially concerned about sleep, is a sleep diary. You can download them online from all kinds of different sources, and they just get you to record things like, when you went to bed, how long it took you to fall asleep, how many times that you woke up overnight, what time you woke up, and some of them are quite detailed. So that can give your doctor a lot of information. So if you can download one of those and fill that out, that would help them when you present with your complaint, your sleep complaint. And if you're not wearing a wearable and you're wondering whether one might improve your health, it's worth reflecting on what you're hoping to change. If having more insight into your sleep or your movement or your recovery would help you make better, more intentional choices, then a wearable might be useful. But remember, the real work is still in the day-to-day behaviors. The device is just information. You're the one creating the change. I hope that's been helpful for you. And if you can think of someone who might be interested in this information, please pass it on. And if you have not rated the podcast, this is a really good time to do that. I hope you have an amazing week, everyone. And until then, I hope you opt to thrive. Hey, before you go, if you're a midlife woman who wants to feel better in your body, whether that means improving your health, building strength and confidence, or working towards weight change in a kinder, more sustainable way, I have created something especially for you to support you. It's called the Midlife Health and Body Reset Kickstart Guide, and it's a free 7-day foundations guide to help you understand what's going on in your body in midlife and what actually makes a difference from here. You can download it using the link in the show notes. And if you're ready to take things even a step further and you'd like personalized support, you're welcome to join me inside the Midlife Reset. It's my coaching program for midlife women who want clarity, accountability, and compassionate guidance as they build strength, improve their health, and create real lasting change. I'm now running monthly intake cycles, which means there's a supported onboarding start date each month, so you don't have to wait for a big launch and you can begin when the timing feels right for you with guidance from day one. You'll find a link in the show notes to get you all the details. And if you're not sure whether it's the right fit, you're always welcome to reach out and ask me any questions. We can even book a little discovery call where we find out if we're a good fit and if it's the right program for you. Just send me a message. Thanks so much for listening and for being here.
The Opt to Thrive podcast is designed for information purposes only and is not engaged in the giving of medical advice. The information provided on the podcast should not be used for diagnosing or treating a health problem or disease. In no way should the information provided by Opt to Thrive be considered medical advice, and at all times the advice of a medical professional should supersede recommendations from Opt to Thrive. If you have or suspect you may have a health problem, you should consult your healthcare provider. The views expressed in this podcast are purely that of Dr. Sims and do not in any way reflect those of the institutions she contracts for medical services to.
Thank you for listening to Opt to Thrive. If you've enjoyed listening, please rate and share the podcast. You can visit our website at opttothrive.com and leave a comment for any subjects you would like to hear more about.